Artificial intelligence could change the world as we know it. That includes healthcare. And while there are certainly risks, there's also great opportunity. As Axios puts it, AI can help with things like discovering new drugs, helping better match drugs to patients, improve diagnostics, and simply helping cut down on all the paperwork providers have to do. These are all lofty goals, but they're still far from a perfect science. That's underscored by recent research published in the Journal of American Medical Association. Researchers found an older version of ChatGPT misdiagnosed 83 out of 100 pediatric cases. 72 diagnoses were completely incorrect, and 11 more were clinically related, but still too broad. Artificial intelligence can be a real lifesaver, but when it comes to diagnosing ailments, maybe not so much. So let's bring in Dr. Omer Awan. He's back to talk with us about this. Dr. Awan, ChatGPT can do a lot of things, but it's not very good at diagnosing pediatric cases. As a way to pull back the curtain, give me a sense of how doctors go about diagnosing cases and why this might be a tricky task for generative AI.
Well, diagnosis in the field of medicine is very tough, as you know, CB. I mean, we rely on everything to make a diagnosis, and a lot of that is nuanced, subtle, contextual information. So when a patient presents with a cough, for example, we look to see if they have a fever, how long the cough has been occurring, what makes the cough better. Is there a particular time of day that the cough is better or worse? So all these contextual integrated information is necessary for a physician to make a final diagnosis. So AI is very good at recognizing patterns and things of that sort, but when it comes to putting all the pieces of the puzzle together in a context, it suffers, as you saw in this, this study, that 83 out of 100 cases were misdiagnosed, and that, of course, would be unacceptable in any, mindset or mind frame, but certainly when we're dealing with patients and we're, trying to take care of patients.
ChatGPT got to go back to residency here. What do these results of this study tell you about how this technology is developed and what kind of input might be needed to improve the efficacy if AI is going to be used for something like diagnosing pediatric cases?
Well, I think it highlights the fact that there needs to be physician oversight. Anytime we use AI or these new tools, yes, they're amazing. They have the opportunity to revolutionize medicine, but with caution, with care, and physicians need to be arbiters and the stewards of evaluating what's right and what's wrong. I think the more we do this, the more we develop AI, the more we train it with more advanced data sets where there's less bias, this will ultimately lead to better outcomes with AI. And you will see, the newer versions of ChatGPT, they will do better. They will do better at diagnosing some of these pediatric cases and all cases, quite frankly. But we're not there yet, and it's still a long ways away. And regardless of, even when it gets very close to being very good, like maybe even 90% effective, we still need to have physician oversight, because even one misdiagnosed case is unacceptable, right? Because we're dealing with people. This is like your mother, CB, coming in and, being misdiagnosed from a chatbot. That would be unacceptable, right? So we have to do our part and our due diligence to make sure that we provide the most optimal patient care, because we're dealing with humans and their health.
And this is a continued conversation whenever folks talk about AI, is who is doing the coding, who's doing the developing, do we have their input to really make this thing as good as it could be? Let's broaden this conversation a bit. Sometimes when we have conversations about AI, the framing is that it's coming, when really, it's already here. So my question to you, how is AI already being used in healthcare settings?
Well, it's being used daily. We use it now to help us decrease burnout, decreasing administrative tasks. AI is already being used in charting, listening to patient-physician encounters where, the whole encounter is being transcribed by a computer, so that decreases paperwork. Even in the field of radiology, which is the field that I practice, AI is being used to help us make diagnoses, like in mammograms, for example, in breast imaging. It's being used to, spot tumors or spot cancers on mammograms, or help us look at cancers and to identify cancers. So it's already being used and it's doing wonders, and it's absolutely contributing positively to patient care. But I think the lesson here is that we have to be careful. There has to be physician oversight, and we have to look at things carefully. And the physician should be the final arbiter, not a chatbot or not a computer, when particularly dealing with important, intricate, and complex diagnoses that we see every day.
Dr. Awan, before we let you go, looking ahead, I'm curious about gaps in healthcare and how AI might be used to help improve conditions. What are some ways in which AI can or should be used in healthcare settings to really make sure that folks are getting the best care possible with the last 40 seconds we have left here?
Well, I think, just in terms of, transcribing medications, communicating with patients, making things easier to understand in a way that resonates with individuals. From a physician standpoint, decreasing burnout. All these things are really amazing, effective ways that will have very positive outcomes with respect to healthcare and for patients. It will be a huge game changer for patients when they can ask a question and their question will be demystified in language that it's very easy to understand. So I think there are a lot of really positive applications that we'll continue to see as we go forward.
Dr. Omer Awan, I'm sure we'll have a similar conversation in the future. It's always a pleasure. Thank you so much for joining us.
My pleasure. Thanks, CB.